Hello and welcome back to Foreign Correspondents. I'm Sorang, and joining me here in the studio is our panel of foreign journalists. Welcome on board.
Good to be back.
Thanks for being here. A fierce public debate has broken out after South Korea granted a permit approving the country's first ever for-profit hospital on Jeju Island. So on this week's edition of Foreign Correspondents, we take a closer look at this new hospital that's wholly owned by private investors, as well as the wider issue of privatization in the healthcare sector. On December 5th, South Korea greenlit the country's first ever for-profit hospital. It's set to open its doors in January on Jeju Island and will only treat foreign nationals.
외국인 진료는 금지하고 진료 대상을 제주를 방문한 외국인 의료 관광객으로 제한하는 조건부 개설 허가를 했습니다.
So Frank, in your view, what's the biggest issue, biggest point of contention surrounding the approval of this hospital?
For me, the biggest issue, of course, is that it's a for-profit hospital and it will generate revenue on people's health care. And if we allow for-profit hospitals, are we going to allow them to do things like necessary surgeries or just elective surgeries? Another big issue is that it's only going to serve foreigners, so it's going to be taking away national resources, at least the real estate that we're talking about, and allocate them to people that are not South Koreans. So there are a number of areas that we can talk about the ethical issues surrounding for-profit hospitals like this one on Jeju Island.
What are your thoughts on this, treating foreign nationals only?
Well, I can see how the people of Korea and Jeju in particular would feel excluded and see this as discriminatory. But I guess I do understand in one way how Korea is trying to increase medical tourism and tourism in general. And, Korea is facing a stagnating economy. So, I guess they're trying to do anything that they can to address that. But in this case, the main point of contention is that the people of Jeju Island had formed this public opinion committee, and they had made the recommendation that they didn't want this for-profit hospital, and the governor had said that he would respect their decision. But then he changed his mind and did not.
He backtracked, didn't he? Up until this point, there has never been a 100% for-profit hospital here in South Korea, and such hospitals being defined by the manner in which they are funded and how they distribute profits. So for-profit hospitals, they operate much like a publicly listed company. Do you see an ethical concern with that?
Well, I'm not against private-run institution per se, but the actual use of local resources, for example, human resources, not only real estate. We're talking about nurses and doctors, and Korea is already a country that is running low on nurses. So it's kind of unsettling that this is a hospital that runs exclusively for profit and only for foreign nationals.
Overall, are you in favor or against for-profit hospitals?
I'm not against for-profit hospitals, and I do think that actually they can benefit the public health system, whereas if you actually keep premiums mandatory for the public health system and you give people the option to pay for private insurance, to go to these private hospitals, those are resources that are not being used, but you're still putting money in the box. So I'm not against them as long as you actually make sure that your public health system, the quality, the standard is high.
Well, I'm going to have to disagree. I'm against for-profit hospitals that provide necessary care. So that's a very important proviso. Big concern with for-profit hospitals is that they will create a two-tier system where you have people that can afford to have surgeries and expensive medical care getting it, and people that don't have that money don't get it, and a degradation of the public healthcare system. You know, people will be able to reduce wait lines and things like that. That's a primary concern in Canada as well. But what will happen is people will get necessary surgeries that are scheduled, and then the more intensive, costly type of healthcare treatments, like emergencies and ambulatory care and long-term care, things like that, the private sector is not going to get into that because there isn't that financial incentive. So again, this would contribute further to the degradation of overall universal healthcare and not really, I believe, support it.
Do you see any benefits of having for-profit hospitals then?
Well, I would say the benefits would be that it would drive research and development into more technologies for healthcare that over time might benefit everybody. But we need to balance those against the other sort of unintended negative consequences as well, I feel.
Okay, and?
Yeah, in the United States, for-profit hospitals are quite common. I think there are 3 times as many nonprofit hospitals, and the problem is, though, that since they're beholden to stakeholders and investors, they are taking their interests maybe ahead of the community's interests. So they have the right to turn away patients that they think will not be able to pay their bills.
Sure.
And so accessibility is a real problem.
According to a public opinion survey conducted back in October, 6 out of 10 respondents said they were opposed to the construction of for-profit medical facilities. Public backlash over the Greenland International Hospital is partly owed to the concern that it could lead to greater privatization of the entire medical sector. Why do you think the bulk of the South Korean public is averse to the idea of privatization of the healthcare industry?
I think they might be worried about rising costs. But, you know, as we know, South Koreans are not averse to the concept of private health insurance in general or overall, because 88% of Koreans do have a supplemental insurance plan that's private. But yeah, I think cost is the main concern.
And they look at the United States and the runaway health costs there and the huge insurance expenses there, and that strikes fear into the South Korean public, I think.
And do you think this fear has been sort of emphasized, highlighted, exaggerated by the South Korean media?
Well, I think, as we pointed out, the fact that this is only for foreigners to kind of is scary. Is like, are we going to use our land, our human resources to start building facilities for foreigners? How about who's going to regulate salaries in these hospitals? I mean, who tells you that doctors and nurses are not going to choose to work at these private institutions? Of course, there's a reason for people being kind of scared.
And there's already some concerns in the South Korean medical community about kind of a brain drain away from sort of intensive, necessary medical health care toward elective health care where doctors can make a lot more money.
For less complications.
For less complications.
Okay. Now, despite opposition in South Korea for for-profit hospitals, these hospital models are easily found across the world. So in the States, what are the main difference between public and privately run hospitals?
Well, in terms of public perception, even though there are a lot of nonprofit hospitals, the general opinion is that for-profit hospitals are better.
That they provide better services?
Yeah, they have more advanced technology, they drive innovation, they might be cleaner, better facilities, less crowded. just overall deliver better care. But for very specialized medicine, that might be the case. But overall, studies have shown that they're actually kind of on par with nonprofits.
And is that the case in Canada as well? Is there a preference if you have the financial resources to go and seek private care?
The pursuit of private care is quite limited in Canada. Canada has universal health care across the country. It's mandated by the 1984 Canada Health Care Act. It's administrated by the provinces, however. It's a federal budget that's administrated by the provinces. The main controversies with Canada's healthcare concern wait lists and the accessibility to care. Those are the main issues that people say, okay, we need to have privatized healthcare in order to generate higher quality care and more responsive, accessive, and quicker solutions to people's healthcare issues.
And what about the public perception in Spain?
People are very proud of it. Only, I'd say, about a third of surgeries are conducted at private hospitals with private insurance, and these are normally not necessary surgeries. The main reason why people get private insurance in Spain is wait lists, once again. The quality of the public healthcare system in Spain is very good, I have to say, very clean, quite advanced. And actually there was a big outcry when some governments attempted to actually shift to some of these public hospitals into private management.
Right. Why was the Spanish public so fiercely opposed?
What happened was Madrid regional government actually wanted to shift some of the public hospitals, the management, into private hands, as has been done, for example, in the UK. So the idea the people had was like, okay, it's still going to be public financed, but if a private company runs this hospital, the first thing they're going to try to do is cut costs. And the quality of the service, the quality of surgery, of consultations is going to diminish. So of course people were very angry at this movement from the regional government, and they feared that the central government, which was actually the Conservative Party as well, would follow suit.
Okay. Now, we looked at Spain. Let's have a look at the States. Over in the States, more than 1 million people each year go outside of the country to receive medical care. What are some popular destinations and popular procedures for U.S. citizens traveling abroad for medical tourism purposes?
A lot of them are going to Asia, so South Korea, India, Thailand, Malaysia, Taiwan. And they are going for, people might think it's just cosmetic surgery, but it's actually really routine, common procedures that are medically necessary.
For example?
So things like, hip replacements or knee replacements or cardiovascular surgery or eye surgery. And it's because of our sky-high costs in the US. These things are so unaffordable there that they feel the need to go abroad and get their procedures done there or abroad. And like last year, 1.4 million Americans were medical tourists.
And are they generally satisfied? Of course, it would depend case by case, but are they generally satisfied with the level of care that they receive overseas?
I think any dissatisfaction with the quality of care would be offset by the tremendous savings that they get. I mean, they can get the same procedures done for a tenth of the price or a fifth of the price, so that's major.
So perhaps their expectations are also in accordance with a lower price. Now, the medical tourism industry is growing very rapidly, with more and more people traveling abroad, not only to get their healthcare needs met, but also to enjoy some R&R on the side. You briefly touched upon this, but would you say that the fact that people need to go outside of their country, or that they not need to, but they choose to go outside of their country to get medical procedures done, is an indication that there is a problem with their own country's healthcare system?
Most definitely, of course, there's a problem with their healthcare system. It can be either because of the cost or the quality. That's the thing. It's not. It depends on what you're talking. For example, Chinese tourists normally prefer, they don't even, some of these people don't even care about the cost. What they want is a high quality, whatever kind of surgery. It's normally elective, as we pointed out, but yeah, I think it points out that there's a deficiency in these countries, of course.
Okay. Now let's move on to the topic of insurance, which inevitably is tied to the debate surrounding healthcare privatization. South Korea's Medical Insurance Act was first enacted in 1963, followed by the introduction of compulsory medical insurance programs in 1977. 40 years since its adoption, South Korea's health insurance scheme has served as a model for many other countries, even being exported to Bahrain. However, not everyone here in Korea is in favor of the state compulsory insurance system. Some citizens prefer private insurance over South Korea's national health insurance system, which they are forced to pay taxes for. So, Anne, should the government consider privatizing some of the insurance scheme as well then?
Well, the problem with privatized insurance in Korea is that the more people rely on it, the more money they're putting toward that instead of the national healthcare scheme. So, South Koreans are worried about rising costs of premiums. And I think there was a survey or something, and they said that they were only willing to pay 7,000 won more per month for their national health insurance. But at the same time, they're paying like 20 times that for their supplemental private insurance. So if they want better coverage and better national insurance, maybe we could direct some of that money to that.
Unfortunately, politicians will never say, pay more taxes.
There you go.
And I think that's really the issue here when we talk about universal health care. If you want to have comprehensive, good universal health care, you've got to ask people to pay taxes.
You need bigger deductions. There you go.
Okay. Now, the US is the highest country in the OECD in terms of medical expenditure per capita. So, do the American public, do they personally face a high medical cost burden?
Absolutely, yes. It's well known that America spends much more than other high-income countries on healthcare, and I think it's like around $10,000 per capita. And Americans, the public, are the ones who are not benefiting from this. So, we have high costs across the board, so our doctors get paid way more, our drugs cost way more, our hospital visits cost way more, and all of those burdens are passed on to the American public. But we think that because we pay so much, we have the best healthcare in the world, but that's simply not true for a majority of people who don't have access to, the best of the best.
Right. What kind of efforts are being undertaken by the federal government to alleviate such heavy burden on individuals for their healthcare?
Well, unfortunately, not many and not enough. The Affordable Care Act, Obamacare, is still in effect because Trump was not able to repeal it, but he did weaken it. So people can elect to go without insurance without being penalized for it. But what happens then is that healthy young people are no longer paying into the health insurance scheme. And so it is, hurting everybody.
Right.
So the deadline for enrolling in the Affordable Care Act to get health insurance just passed, but the public awareness of signing up is very low.
Okay, all right. Now this next question is for you, Frank. Universal healthcare in Canada, it's often cited by other countries as a model to emulate, including U.S. Senator Bernie Sanders. Why do you think this is the case? Why do you think so many people see Canada's universal healthcare as a model to emulate?
Well, the reason that it's seen as a model to emulate is because it is universal and everybody gets care. Nobody's left on the doorstep of a hospital without treatment. But it's not without controversy. While you'll see in the States a lot of people, especially those on the left side of the political spectrum, like Bernie Sanders, will say that's the model that we're after, especially given our proximity to the United States. There are some controversies about the Canadian system as well, and some people's call for more privatized aspects to Canada's healthcare.
Could you elaborate further on some of the controversies?
Well, there was a big issue actually in Vancouver about one clinic wanting to offer private medical services to his patients that could afford it, and he couldn't do that. Actually, in Vancouver, a good friend of mine has been hired by a medical institution to increase efficiency of hospital rooms. And at this clinic, the doctor mentioned that the hospital rooms in Vancouver close at 4 p.m. And so it's kind of ironic that they're closing so early, and then I have this other friend, again, that's trying to increase efficiency in hospital rooms. When I think about outside of this, when we think about public servants, we think about the Iron Rice Bowl and in Canada and elsewhere perhaps some inefficiencies. That is part of the universal healthcare system undoubtedly when you have operations closing at 4 p.m., essentially shorter than bankers' hours, and initiatives to try again to make this more efficient, and then calls to allow privatized healthcare. I think this is always going to be a debate.
All right. Now, so our discussion so far boils down to the question of whether you can see healthcare as a public commodity or whether it should be seen as a market good or a service that is determined by the invisible hand of the free market. So what's your position on that?
No, I'm totally for public commodity. I mean, I think universal healthcare should be provided by the state. I think it's one of the most important parts of a welfare state, right? Taking care of, guaranteeing, actually, it's something that avoids widening already inequality gaps, actually. Having people get the same treatment as someone who's richer or has more resources. Totally, yeah.
I absolutely agree. I mean, income inequality is directly correlated with healthcare inequality. And so it's not fair that only the richest people can, have the best healthcare and be the healthiest. So I think in America we have a problem, and healthcare should be treated as a public good.
I agree with these guys pretty much. We're all sort of on the same side. I would say that privatizing elective surgery and elective healthcare would be fine, and that would generate tax revenue that you could put into the public healthcare system. And we need to recognize also, besides looking at how this plays out within the healthcare system, the argument between private and public, I think we need to recognize how it plays out in terms of the culture and the philosophy of our societies in general. Do we want to have an egalitarian, caring society, or is it fight of the fittest?
And then there's another thing. South Koreans go to the doctor a lot. They go to the doctor almost, right, twice as average OECD people. They go like 14, 15 times a year. This is something that needs to be addressed because you're straining the resources of the public healthcare system, for example.
So you think some of those visits are perhaps unnecessary?
I guess so. I mean, I don't know how to tackle it, but definitely there's a big difference there. Yeah.
Okay, Anne?
Yeah, South Korea, among OECD countries, I think they pay the most out of pocket for their healthcare, and so that's a problem. But as we were talking about, if they were disincentivized from going to the doctor so often, a lot of that money could be allocated in different ways.
Okay. We'll have to wrap it up there. Thank you very much. Thank you.
Thank you.
One of the pledges outlined in the World Medical Association's Declaration of Geneva is the following: the health and well-being of my patient will be my first consideration. We hope this pledge will remain a constant despite the evolving nature of the healthcare sector. That's all the time we have for today. Thank you for tuning in, and goodbye.